Another key provision that's going to save $15 billion over 10 years is unnecessary hospital readmissions. I have been going to all the hospitals in our territory, which is pretty big, and meeting with the case managers, the CEOs, the CFOs, anybody who will listen, to talk about readmissions and how home health care can help you to reduce those readmissions. We implemented a program 2 years ago. Our readmission rate at that time was 24%, and now we're down to 17%. So it works. It's telephonic, it checks on our patients, it's quality care, and it's the way that we've educated our providers to provide the best care. Hospital-acquired conditions, does anybody know what those are? So you get into the hospital and you get C. difficile and you have diarrhea and you're sick. You know, hospitals are not that clean. My father was a physician. I remember I was in the hospital once. He goes, "You got to get out of here before you get sick." I said, "Okay, I'll get out of here." So if a patient acquires something in the hospital, Medicare will not reimburse them. So now let's say you have an individual who has some sort of wound on their body, and they come in through the emergency room. They need to check head to toe. They need to document this wound. Otherwise, Medicare will say, "Oh, well, that must have happened in the hospital. We're not going to pay you for it." So they want to make sure they cover everything. With readmissions, they started out with a few diagnoses, chronic illness diagnoses. And now they're expanding it to surgical procedures. If you're readmitted to the hospital within 30 days of your discharge for the same condition, then they're penalized by 2%. And it goes up year after year after year. I would say in the next 5 years, it'll be every condition. Then they're going to skilled nursing facilities. And if they're readmitted from a skilled nursing facility, then they're going to be penalized. And then there'll be home care. Everyone will be penalized. So that means we have to work together as partners. And that's why I'm the Director of Healthcare Partnerships. We need to have a post-acute provider council that works together to ensure that our patients are receiving the right care at the right time in the right setting. They talk about bundled payments. You know, this is also insurance reform. So bundled payments are by kind of like a DRG or by diagnosis. But it could be between a hospital and a medical group or a hospital and a home care agency. And that will be just a different way in which we're reimbursed for the care that we provide. However, there could be a group that decides that they can do it all themselves and they want to keep all the money. So it'll be interesting to see what changes happen over the next 5 years. Of course, they're going to reward better care and they're going to give bonuses for better care. And that makes sense. 2% increase if you meet all the quality measures.